what is your assessment of based on your readings of the country, your assessment of the pandemic response in the country, and your reaction to the Philippines lifting its state of public health emergency for COVID-19? Because a few months after the World Health Organization lifted the emergency phase of the COVID-19 pandemic, what are your thoughts about this?
Thank you. I think when the world started to fight against COVID, I wasn't here. But when I look at the data, given the size of the population of the Philippines, I think we can claim, despite the fact that I regret to say that, about 60,000, if I'm not mistaken, 66,000 deaths in the Philippines. But I would say comparatively, we can say that the management to control the COVID-19 in the Philippines is quite successful, right? Now, the issue now is that let's look at it, let's document the stories, the success stories that we have done so far, so that we can learn from it. Of course, when I say it's a success story, but there are, of course, many things within those success stories that we can learn from, right? So that's the bottom line. Now, the announcement by His Excellency President of the Philippines, I think this is something has been preceded by the announcement by the Director General of the WHO on May 5th that COVID-19 is no longer a disease of public, with PHEIC, no longer. Now, what is this? When the DG announced this, number one is because the world wasn't ready. Tell me, no country in the world was ready for that. Therefore, we need to raise the awareness, the concern of the global community that this is disease of threat to human being, right? And then at that time, we don't have any tool, right? Forget about the test. The test was developed after that. And then the last one came to us is vaccine, right? So these kind of things push WHO Director General to make that, or to declare COVID. Now, let's look at the conditions. I think, regardless of coverage, I think particularly the booster, we are here still quite low. But the tool is there. Right? We have the gun to shoot this guy, okay, COVID-19. We have vaccine, we have knowledge, we have experience, right? Therefore, it's no longer a public health disease of public health concern globally, right? However, I would like to remind all of us, despite this announcement, the virus is here, it lives with us now, right? Therefore, our recommendation to the government is to integrate COVID-19, including COVID-19 vaccination, into its routine program. So that we can do while we continue to do a good surveillance of which we have learned earlier. So we continue to, strengthen the surveillance system. In case there is an increased number of cases, we are able to detect as early as we can, and therefore we are able to take actions as early as we can. So that is the situation. So thank you.
Thank you.